Many Australians use phone apps to help track their periods for convenience, contraception, or to better understand fertility and reproductive health. But while the period trackers may seem like an easy way for people to keep on top of their cycles, experts say they're not without risk. Analysis of 12 popular apps has found they collect deeply sensitive data about consumers' sex lives, general health, emotional states and menstrual cycles, and many of them can be used by children as young as 13. Researchers also uncovered a number of concerning features on them, including confusing and misleading privacy messages, a lack of choice in how the data is used, inadequate de-identification measures when data is shared with third-party organisations, and the retention of data for years, even after a consumer stops using the app. Dr. Catherine Kemp from the University of New South Wales is behind this latest research and joins us now. Welcome, Catherine. Why should we be cautious about the use of these period tracker apps?
Gemma, this is one of the areas where we can see where there are failings in Australia's current privacy regulation, in that we don't have adequate definitions of what personal data is or what consent should look like. And why we need to be particularly careful here is, as you can see from that kind of information you've just described, people are in a very vulnerable position when they are depending on these apps to give them information about their health and about their potential conception, pregnancies, but they don't know what's happening to that highly sensitive information.
And many of the apps, they say they don't on-sell the data, but you found that the terms and conditions tell a different story. Can you tell us about that?
Yes, so what we see in some of these apps is in the big bold print where they're marketing to the consumers, they will say, "We never sell your data." But then hidden away in privacy policies, those same apps will sometimes say that they will in fact sell your health data if they decide to sell the app or the database as a business asset. And that's not just theoretical. We've seen some of these apps being sold to entirely different companies. So, for example, a drug company or a digital media company might later buy that app and have very different motivations to the original owner of the app.
And with those motivations, I mean, what can we then see come of this data being shared with people that they otherwise weren't meant to be?
Some of these apps are actually using this as an opportunity to extract or harvest health information and then to sell it on to other companies, sometimes for the purposes of advertising. In some cases, they say that they will de-identify this information and sell it to a broad range of other companies who might want it. And yet the de-identification that they are describing is entirely inadequate for health information. In some cases, simply saying, "We will remove your email address or your name and the rest of the file will stay intact." And when you have, for example, the birth dates and information of multiple children and relationships and health information, that's not enough to anonymise you.
So have we got any examples of users fighting back against this?
At the moment, there are very limited ways that users can protect their privacy because, as I mentioned before, we don't have adequate privacy regulation in Australia. In other jurisdictions, however, we have seen consumer regulators in the United States, the Federal Trade Commission, for example, bringing action against some popular fertility apps, and class actions in the United States by consumers alleging that they have been misled about how their data was going to be used and the possibility of the sharing of that information.
And I mean, the US is an important point. There's the added concern there for users in the wake of the changes to abortion laws.
Yes, this is something that has been in the forefront of the minds of many people involved in women's health advocacy and consumer organisations in the United States, to the extent that there is actually a movement in the US where people deliberately enter false information into some of these fertility apps so that it undermines the accuracy of that information were it ever to fall into the hands of law enforcement enforcement who might be interested in that information for the purposes of enforcing anti-abortion laws.
And as to these apps, which are gathering all this information, are they free or do they come at a cost?
Certainly, they come at different kinds of costs. Many of them actually charge a subscription fee, and they might charge a fee of, say, $100 a year, sometimes more, and so are not free even from a monetary side of things. But even those who market themselves as a free app are sometimes, often in fact, collecting such an enormous and sensitive range of data about the consumers who are using these, that it can be potentially very costly. As we've seen from the Optus and Medibank leaks last year, it is not safe to be keeping information like this for years on end, which is taking place with these apps. And the information that is collected and retained in that way and shared can be used against the interests of the people who are seeking these technologies for very valid and important reasons themselves.
And so you're looking at a lot of risk or perhaps a lot of money, perhaps both. Just how accurate are these apps anyway?
That's the other interesting thing here, is that others with different expertise to mine, more in the health field, have been pointing out that some of these apps are not upfront about how accurate they can really be in predicting when somebody is ovulating, for example, when they're going to get their period, their chances of conceiving, and that can have very important impacts on people who might be trying to have a baby or trying to avoid falling pregnant. And if they are relying on the app in this way, but there hasn't been a demonstrated accuracy in their use in this way, in their efficacy, then you have a very different kind of risk and utterly life-changing in some cases.